So, David,
I'm impressed, Jason. Way to go.
Thank you very much. You answered a number of questions this morning regarding local issues and the economy here. What do you feel is the main issue facing Sault Ste. Marie at this time?
Well, jobs and economic opportunity, employment issues continue to be one of the top issues right across Northern Ontario. It's not unique to Sault Ste. Marie. It is something that is a challenge across the region and in, rural parts of Southern Ontario as well, where youth continue to leave for opportunities elsewhere. So, we're working very hard to develop programs as well as make investments in local businesses. In the last almost 12 years, we've invested over $95 million in local businesses through the Northern Ontario Heritage Fund, which has created or protected 2,800 jobs here in Sault Ste. Marie. Just recently we announced $1 million for Bonifero Millworks. There's a capital investment project there that Bonifero's undertaking, about $3 million. It's estimated to create 30 to 35 new jobs, which is great news for the community. So, we need to work very hard to continue to do this. We need a federal government that's at the table as well with us. A matching program with FedNor of $100 million, like the Northern Ontario Heritage Program, would be great. I mean, we would be able to do more with those resources, obviously, here in the community. But we're continuing to focus on economic opportunities. And as you're aware, yesterday we announced a $120 million permanent energy rebate reduction program that means a lot to our local major industries. It reduces their energy costs by an estimated $10 million combined per year. And that ultimately is protecting jobs here in Sault Ste. Marie.
That's one of the questions I was going to ask you, David, was that decision. This is something that industries have been wanting since the Liberals were first elected in 2003. Was there a tipping point or a catalyst to finally get this decision made?
Well, the program that we put in place to reduce their costs by up to 25% was a 3-year program. And so what we were hearing from industry was that we're happy with the program, we like the program, but we need to know that it is ongoing and it is a long-standing permanent program, because that will influence our decision around capital investments, around the number of jobs. If they have to, be impacted by that program potentially being removed, that is up to 25% increase in their costs of energy, which has an impact on their business model. So there's an impact there, and we listen to business. We listen to large industry in Northern Ontario, and I'm very pleased that we as northern members in our government have advocated and have the support of the Premier in moving forward with this particular initiative. So it's great for business, great for Northern Ontario.
Sticking to the topic of tourism, we're switching to that. What do you think of the decision by the federal government? We heard some of your views this morning on their inaction or sort of 11th hour decisions. This regarding the funding for the Algoma tour, or the tour train that was decided kind of at the last minute. They're still waiting for
the passenger rail service you're referring to.
Yeah. So I mean, this was kind of an 11th hour decision. What's your view on that? And should something have been done sooner to maybe?
Well,
get that,
you know what?
urgency of this issue?
On that particular piece, I think the federal government has put the resources in to work with an organization recognizing the benefits to Northern Ontario residents, and obviously I'm not critical of that. That's welcomed news to people in our community, and credit to the federal government for making that investment. We need to see more investments like that in Sault Ste. Marie and in Northern Ontario and build on that. So that's helpful, absolutely.
The Surrey Hospital's financial issues were mentioned. That was another one of the questions. They're $10 million less than expected. What is going to be done there to alleviate their situation? The local health coalitions have been gathering. They've been speaking out about this. What does the province plan to do, if anything?
Well, first of all, let's talk about whether or not it was expected, and we'll talk about the volume here. In 2012, the Ministry of Health, identified the hospitals that the formula is changing. And I'll start that question again on the healthcare. With respect to our local hospital, the budget of the hospital has been increased substantially, the base budget, since we've come to government by approximately 50%. Healthcare spending in Ontario has gone from $29 billion to $51 billion, 75% more money into the healthcare system in only 12 years. The circumstances with our local healthcare and with our hospital, we are continuing to develop services and capacity throughout the community. In other words, shifting costs and shifting resources to some extent, being mindful that the hospital is still a very, very key organization in the healthcare system, and that's why we've increased their budget by about 50%. Cancer radiation therapy is available at the hospital, the only standalone bunker that exists in all of Northern Ontario. We've made huge investments. There are more nurses working in the community. There is more home care today. There is more long-term care opportunities in Sault Ste. Marie. And so we continue to shift resources to areas where residents would prefer to be and where it's more cost effective to deliver. But we worked with our hospitals across the province in 2012 and identified that the formula for funding hospitals would be changing into a model where the dollars follow the patient. It's an expectation that we have that there would not be simply dollars given to the hospital, but that those dollars would be targeted to actually support patients and follow patients. And so, you know, in the past year, there has been a freeze on the hospital's budget. The process or the reference to that you're talking to is over a number of years, not simply a change in budget over a single year, and it's something that hospitals have known about for a number of years. It also, we need to put into context the investments that are being made in the community to support community resources. So while we continue to enhance programs and services at the hospital, we're continuing to work on the angioplasty initiative, which is the newest initiative province-wide that the hospital would like to bring to the community so individuals don't need to leave, as we've done with radiation therapy, and that's a service that I support and I'm advocating for and have spoken to the health minister on several occasions about. And I'm optimistic we'll get there on that particular service.
Just one last topic, David. You mentioned the Deepwater Port being the most important issue facing the Soo right now. You describe it as a game changer, and just how beneficial is this going to be for the Chamber, for business, and really for everyone in the Soo and Algoma?
Well, you know, a deep harbor facility in this community will help support our primary industry, our major employers, and will have the potential to grow the region economically. And it does involve, obviously, a substantial investment by industry and by senior levels of government. And that's something that we're committed to. Both ourselves and the federal government have committed $2 million to do the in-depth analysis and report to help develop the port. And then we'll need an investment from all of the parties to ensure that this can come to life. But it is, as I've said when we first announced the funding for the study, a real game changer in Sault Ste. Marie, and it's something we need to continue to work at.